The Varios 970 ultrasonic scaler from NSK, with its wide range of compatible tips, is ideal for everyday clinical use. The new Varios series incorporates a variety of advanced functions within its sleek body. The most important of these is the iPiezo engine with next-generation artificial intelligence. Conventional products require the operators to adjust power settings when they encounter hard calculus. The iPiezo engine is an ecologically friendly engine that incorporates two advanced functions. A feedback function that maintains a constant stable power supply even when the state of the tooth surface changes, for example from soft to hard calculus, and an auto-tuning function that ensures that appropriate power is exerted at the end of the tip. It accurately reflects the operator's intentions in a responsive manner, enabling reliable scaling that is gentle on the patient. The new Varios series handpiece is light and easy to hold, with a slim design to make it easier to perform delicate operations inside the mouth. The handpiece can safely undergo autoclave sterilization and hot water cleaning. The handpiece is tapered towards the end, enabling easy access to even difficult-to-reach areas, such as the distal surfaces of molars, as well as ensuring a wide operative field. It's also fitted with long-lasting LED lighting that requires less frequent replacement. Its light closely resembles natural light, illuminating the inside of the mouth more clearly, making it easier than ever to see the state of tartar and plaque adhesion. NSK's proprietary twin LED lights also cast fewer shadows, providing even illumination throughout. The Varios 970 is an ultrasonic scaler that can be used to treat a great variety of cases. Simple and compact in design, it requires only a small amount of space, but it is hugely effective. It has a large operating panel, offering good visibility and ease of use. The various operating keys are labelled with clear icons for instant recognition at a glance. The power at the tip can be selected using the mode settings, as well as the power up-down key. The power range has 11 settings from 0 to 10. These offer the optimum power for each treatment, from high power for dislodging stubborn tartar to weak power, ideal for maintenance. The irrigation volume is also easily adjusted by turning the irrigation volume control knob on the left-hand side of the unit. Two large water bottles can be fitted with a capacity of 400 ml each. Switch between bottles by simply pressing the switch key with no need to interrupt treatment to change the bottle. Medicament solutions can also be used instead of water. Optimal irrigation volumes for different types of treatment can be preset in the memory. When a bottle is in use, the bottle lamp at the front of the unit lights up, instantly showing whether the right or left bottle is being used. The switch key is used to switch between the right and left bottle. External irrigation can also be used depending on the type of treatment. The foot control has a 360-degree range. The unit is activated no matter which edge of the circular control is depressed. The Varios 970 complete set includes all the necessary accessories to get started from day one. The set includes 3 tips. The G4 tip has a rounded cross-section, making it ideal for removing soft calculus and finishing. The G6 tip has a fine point, enabling smooth access inside deep pockets. It's particularly well suited to removing calculus below the gingival margin, as well as above. The G8 tip can be used at high power, making it effective for removing hard calculus above the gingival margin. The pump and handpiece are simple to clean after use with the auto-cleaning mode. First, fill the bottles with clean, purified water, then just press the auto-cleaning key. It washes out any dirt or disinfectant solution from inside the pumps, tube, handpiece and tip, leaving the left and right irrigation routes clean. It can be left to run by itself, taking approximately 60 seconds to clean the system automatically. The system includes 2 pumps, one for each bottle. They are easily removed and refitted using the instruction diagram supplied. No tools are required. Maintenance can be carried out on site, requiring little time and effort. Use the tip wrenches supplied with the set to easily remove tips. With the tip wrench, tips can be fitted to and removed from the handpiece hygienically and safely, without directly touching them with your hands. After use, detach the handpiece from the cord and place it in the sterilisation cassette. The cassette can be placed directly into a steriliser to help manage instrument decontamination. The lineup of various tips is divided into those for use in scaling, periodontics, endodontics, implant maintenance and restorative treatments. In all, there are over 70 different tips. This wide-ranging tip lineup from NSK expands the possibilities of ultrasonic treatment enormously. Let's take a look at how this lineup can be used in everyday clinical practice for 11 different patients. A wide selection of tips is available to enable optimal care for each patient. The G8 tip has a semicircular cross-section that minimises damage to the gingiva, enabling it to be used at high power. Using the side rather than the end of the tip, the angled portion acts as an edge, enabling the effective smooth removal of large amounts of hard calculus adhering to the teeth. Sweeping strokes are used at an angle of 15 degrees to the tooth surface. The G4 tip can be used at high power, meaning it is effective for tasks such as removing calculus above the gingival margins. Be be careful to use the 2 mm or so from the end and maintain an angle of 15 degrees with the tooth surface. This tip has a round cross-section that minimises damage to the tooth surface, meaning it can also be used for stain removal and finishing. The G12 tip has a diamond-shaped cross-section, and using the angled portion against the teeth enables effective removal of calculus above the gingival margins with this highly versatile tip. The angle can be placed against the teeth from any direction, meaning it can be used throughout the entire dentition, from incisors to molars. Skillful use of the end of the tip efficiently removes calculus adhering to the gingival margin. The G8 tip has a semicircular cross-section and can be used at high power. Its fine end and overall shape fits the tooth surface perfectly and makes it ideal for removing hard calculus adhering to difficult-to-reach tooth surfaces such as interdental spaces and molars. Pay particular attention not to hold the end of the tip vertically against inflamed gingiva such as these. The G4 tip has a round cross-section that minimises damage to the tooth surface, making it ideal for use in stain removal and finishing. For stain or nicotine tar removal, keep the angle between the tooth surface and the tip small and use fine, sweeping strokes. It can also be used to remove calculus above the gingival margins by increasing the power setting and adjusting the tip angle. The P1 tip has a round cross-section that minimises damage to the tooth surface. The end is extremely fine, making it effective for stain removal and finishing in areas of thin gingiva and around the root. Do not stand the end of the tip vertically, but maintain a small angle between the tooth surface and the tip and use fine, sweeping strokes. The G6 tip has an elliptical cross-section and an extremely long, fine end, making it ideal for removing calculus adhering in deep pockets. It provides smooth access even to highly inflamed gingiva. To remove clumps of calculus efficiently, work with the goal of placing the side of the tip around 2 mm from its end against the teeth. The P10 tip is sharp-edged, making it ideal for removing stubborn calculus below the gingival margin. The state of adhesion, difficult to sense when using an ultrasonic scaler, is transmitted to the fingers, enabling accurate operation below the margins. Maintain a small angle with the tooth surface and make strokes along the root surface so as not to damage the soft tissue if the gingiva are highly inflamed. The P11R and P11L tips are the double-curved, sharp-edged type, making them ideal for removing firmly attached subgingival calculus. Their shape, designed with reference to the curved form of the curette scaler, enables smooth access to narrow pockets of anterior teeth and interdental areas of the adjacent teeth in the molar region. The small curves mean that either the P11R or P11L can be used for the entire dentition without having to change the tip. The P2D and P3D tips have fine ends and a double-curved shape, enabling smooth access to narrow pockets and adjoining molar surfaces. They are diamond-coated, ideal for removing calculus from molars and interdental areas. Make strokes while being careful to ensure that the portion 2 millimeters or so from the end remains in contact with the surface of the root. The P26R and P26L tips are the double-curved, sharp-edged type, making them ideal for removing firmly attached subgingival calculus. The long primary shank enables operations to be performed smoothly, particularly for narrow interdental spaces and complex root surfaces. Unlike a hand scaler, use up and down push and pull strokes while grasping the boundary between the calculus and the tooth surface. The P1D tip has an extremely fine end, enabling access to crowded areas and areas close to the root without forcing strokes. The fine end is coated with diamond powder, making it ideal for removing calculus adhering to areas that are difficult to access. Keep the angle with the tooth surface to within 15 degrees. The P20 tip has a round cross-section and is long and fine, enabling smooth access to pockets throughout the entire dentition. It minimises damage to the tooth surface, making it perfect for maintenance. During maintenance, make strokes without creating an angle with the tooth surface. Try and use the end of the tip for finishing the root surface after calculus removal. The P21R and P21L tips have a round cross-section and are long and fine, while their gentle curves avoid the cut-off angle of the molars to fit easily against the root surface, offering outstanding manoeuvrability. They minimise damage to the tooth surface, making them perfect for maintenance. During maintenance, make strokes without creating an angle with the tooth surface. Try and use the end of the tip for finishing the root surface after calculus removal. The P2D and P3D tips are fine for their entire length and have a double-curved shape, enabling smooth strokes at the furcation. They are perfect for soft calculus removal and maintenance. The P26R and P26L tips have a long primary shank, offering good access to the furcation and complex root surface and enabling smooth strokes. Their sharp edges make them ideal for scaling at the furcation and other areas. The P40 and P41 tips are specialist irrigation tips that provide irrigation in two directions, offering smooth access to pockets. They have a 3mm wide marking 6mm from the end, enabling cleaning to be carried out safely and with confidence in accordance with pocket depth or a specific purpose. This tip can be used effectively for biofilm removal and cleaning. Its tapered shape avoids damage to the gingiva and root surface. The VP lineup, which utilises plastic materials, is ideal for use in the maintenance of implant bodies and prostheses. The tip has a fine end, enabling the effective removal of plaque and soft calculus adhering to porcelain or crown margins. For effective use, stand the end vertically and work using the end of the tip only. The double curve design of the VP11R and VP11L tips are ideal for working anterior to posterior and mesial to distal without damaging crowns, making these tips highly versatile. The curvetted design of the VP26R and VP26L tips offer access to areas that are difficult to reach with the end of conventional instruments, such as the mesial and far end of the last molar and posterior teeth.
Welcome to the fascinating world of ultrasonics. The use of microtips allows us to eliminate hand curettes from our list of necessary instruments. With the IPiezo technology of Varios and the design of NSK microtips, periodontal treatment can now be more effective, shorter and less painful. Often, symptoms suggesting the necessity of periodontal surgery disappear after treatment involving these tips. The treatment in these deep pockets is achieved in different stages and at low power, thereby avoiding the need for anesthesia. Immediately after treatment, the patient is able to lead a normal social life.
The philosophy of these low-power piezoelectric treatments is based on the ecology of the surrounding tissue. We respect the characteristics of this tissue to encourage long-term healing. You can understand why this therapy has to be based on trust. It's the trust in biology to allow time for the regenerative potential of the cementum and the gingival tissue. Even infected periodontal tissue can be preserved. The periodontal tissue is cleaned and becomes biologically compatible again to reattach to the tooth. To achieve this, we're proposing to change common practice. Common practice is to use large tips at high power. However, we're suggesting that if the enamel and hard tissue supports high forces, the automatic reaction of increasing pressure on the tip or to increase the power against a resistant deposit should be avoided in contact with the cementum.
It's important that we take a look at the different indications and how to use NSK tips, because understanding the functioning of the NSK Varios system and the available tips allows us to treat about 80% of cases of periodontitis in general practice. The periodontal tips are divided into two groups. The G-tips used with higher power to remove tartar in contact with enamel, and the P-tips used in periodontal pockets in contact with the cementum used at low power. The design of the P-tips means that the active region of the tips is in the last 2 mm, and using the tip correctly, we can compensate for the loss of power and at the same time increase efficiency. It's essential to position these last 2 millimeters tangentially to the surface of the treatment area.
There are 3 types of P-tips: the micro tips shaped like a curette, the diamond-coated tips, and the micro tips with round sections. The piezoelectric movement of the tip is totally along the long axis of the handpiece. This movement, associated with the low power, allows us to work as previously described, to preserve tissue cementum, improve patient and practitioner comfort, but also fundamentally to support the tactile sensitivity of the operator. As in endodontics, in periodontal treatment, the tactile sensitivity of the operator is paramount, because the operator has to analyse and understand the root reliefs and surfaces using his tactility. The ergonomic design, combined with the exceptionally light weight of the NSK handpiece, play an important part in the perception of the subgingival anatomy of the tooth.
The P10 tip is the tip for general use. We use it in the first stages of treatment to remove supra- and subgingival deposits. As both sides of this tip are sharp, operators must be cautious near the gums and should only use the vibration of the tip to remove deposits. Unlike manual curettes, however, it's important not to exert strong pressure on the surface. The effect of curettage is not desired. The vibration of the tip removes the deposits without damaging the cement.
The P26R and P26L tips are angled to gain access to the most distal areas of the oral cavity. They are adapted to the anatomy of the molars and deep pockets. Longer than the P10 tip, the amplitude of vibration is greater at equivalent power. Both protruding lines work on the surface for incising the pockets, and access to wide furcations is possible.
The cross-section of the P1D tip is round, and its end is diamond-coated. This tip combines a diamond burr and a curette in one instrument. The P1D tip should always be used in motion. The extremely slim design helps to develop the tactile sensitivity of the operator.
The P2D and P3D tips are very fine and feature diamond-coated tip ends. They are ideally suited to penetrate narrow furcations and to explore the complex root contours. They're suitable for detecting and removing any remaining hard deposits. They should be used on a low power setting and always in motion.
The P1 tip, with its round cross-section, is dedicated to the elimination of subgingival biofilm and calculus. It should be used to explore and debride the remaining periodontal pockets during the maintenance phase.
The VP10 plastic tip is a dedicated tip which is being used during the maintenance phase of periodontal and implant treatment. The plastic surface of the tip protects ceramic and titanium surfaces to prevent scratches and fractures. This tip is also indicated in cases of hypersensitivity. It is used at medium power. NSK's VP10 tip is long-lasting and fracture-resistant. NSK provides handpieces that prove to be powerful partners. Your NSK handpieces and the human hand are inseparable, powerful partners.